I've been referred to a consultant for having non-alcoholic fatty liver disease, and there was a phone call one evening asking me would I be prepared to participate in the trial. It was very professionally set up. There was nothing intrusive about any of the tests I felt, and it gives you a wide range of tests that help you, for your own analysis of a body. Some of the results had an expected or normal level against them versus your own personal results. Coming to the session this morning, I've spoken with one of the nurses and we've gone through some of them, and some of the abnormal results, if you want to say, are normal for someone with the fatty liver disease.
Well, I had a bad problem with my liver, and I was here in Southampton, and one of the doctors asked me if I would kindly like to participate in the trial, and I said yes, certainly. Obviously, when I got this piece of paper through the post, I thought, I didn't understand any of it really, but since I've seen the talk today, I've understood a lot, and it's made a lot of sense.
What you'll see in the test results that we sent to you is your test results at the beginning and your test results at the end. So we're interested in, does the change that we made in intervening with the medication, did it make any difference? Did it improve matters or did it make matters worse? And that brings me to a really important point. Across a group, we see very variable effects. So not everybody in the OMacor group got the same effect. Not everybody in the placebo group didn't get an effect. The effect is very variable, and what we need to do in doing further research is understand why that effect of the treatment is variable.
So at the very beginning, it did seem like a huge task to try and find 100 volunteers for this study. But what we've tried to do is to sort of still look at each and every one of you as an individual and guide you all, on your own sort of process.
The doctor wasn't happy with the blood samples I was given, and he thought I should go further for this test of over the last 18 months, and of which I found has been hopefully very helpful. And I'm waiting to see the doctor now, or the professor, just to enlighten me on a few other things which we'd like to query him about.
So the first thing to keep in mind is that omega-3 are actually a type of fat, and we're talking about them being healthy. So the first lesson, I guess, is that not all fat is bad. So you have more healthy and less healthy fats. The nature of the diet that people eat determines how much total fat they eat and also the type of fat that they eat. So if we look now, breaking this down into a pie chart, and say how much of this comes as saturated fat. So this is the type of fat that raises blood cholesterol, very bad for increasing risk of heart disease. So for most people, or the average person, about a third of the fat they eat is saturated fat.
So why do I care about little blood vessels? Well, I've cared about them all my research life. They're the very smallest blood vessels in the body. They're in all of our tissues, but if blood flow through these vessels goes down, or even the number of vessels goes down, then they're less efficient at delivering the gases and the glucose to the working tissue. And so when you put demands on the tissue, like when your heart needs to work harder, when you want to run away, do some exercise as they've made you do, if these little blood vessels aren't being perfused effectively, then you're not so effective at doing the tasks that you want to do. And that could even be in the brain and thinking. But long before we see those symptoms, those manifestations of microvascular disease, we can detect early changes. And so what you were helping us with in this study was saying, well, if we measure the function of your little blood vessels now, what does that tell us about what's going to happen in the future?
The whole project has been fascinating. I've enjoyed discussing every test, what it was meant to achieve, gaining feedback from the nurses, doctors. What's become clear from the presentation we've had today is that I also lost 5 kilos, which I feel was because the drug made me feel quite positive, or the trial made me feel quite positive, and that helped me become more active at the same time as taking it. So I think I've probably benefited from a double bonus of partly losing weight by being on the trial and partly from the drug itself, because the benefits for me have been quite substantial.
We think that possibly vibration could be a marker of vascular function, and this is in people who don't have any real sensory loss at all. And vibration is also linked with the risk of cardiovascular event, of having a cardiovascular event in the next 10 years. So this is starting to paint a really interesting picture for us, because all these things are quite similar. Small blood vessels, risk of cardiovascular disease, and deposits on the artery are all related to the vessels that are throwing blood around your body, the arteries that are taking blood around your body.
I got referred by my GP to a consultant to check my liver. At the end of the consultation, they said, well, actually, your blood levels aren't too bad, but you've got fat on your liver. Would you like to participate in a trial? And I said, yes, very quickly, because I find it's one of the most important things that I can do is to find out about myself. And it was an excellent way of participating in an experiment and finding out how my own body worked.
I think we ought to thank you for what you've allowed us to participate.